Good evening and welcome to Health Quest. I'm Deborah Arneson, bringing you a great show tonight. We're going to be talking about your colon and colon health and the truth about colonics. And we have with us a repeated guest, one of my favorite, of course, because, hey, we're related. This is my daughter, Christina, and Christina Pfeiffer is actually the renowned colonic hydrotherapist of Chicago, and she owns Colon Care, Inc. Here in Chicago, and she's going to share with you the problem people are having with their colons today, of which there are many vast and varied problems going on. I mean, in my practice alone, I probably see easily probably 2 out of 3 people who are very constipated, if not more. And, you know, unfortunately, they come in and think they're not constipated because their doctor tells them they're just fine generally, and if you move your bowels once a week, it's okay. It's not okay. So we're going to talk about the truth about colonics and why people seek colonic hydrotherapy, and what the misconceptions are and how we can erase some of those fears that many of you might have regarding colonics. So thanks for being with us, Christina.
Thanks for having me again.
It's great having you back.
It's good to be here.
So tell people here, what is a colonic?
It is a gentle cleansing of the colon. The average colon is anywhere from 5 to 6 feet long for the average adult.
Okay.
And it's a gentle infusion of water to cleanse the colon. It's pretty basic. It's not too invasive. And it's a pretty painless process.
It's actually pretty relaxing, in my opinion. It's about the only time I get to lay on a table and have someone rub my tummy and not have the phone ring. So, you know, it's really very soothing. And you do some breathing, and you do some acupuncture or acupressure meridians, where you do some
trigger point
work that really helps the releasing process.
On the legs and the feet, yes.
Yeah, one day she was rubbing my feet. It felt so good. It's great.
It really does help.
And it helps you to release. And then you have an oil that you can smell.
Yes.
That helps you to release as well, and use some aromatherapy.
Yes.
So what is the difference between a colonic and an enema?
There's a couple main differences. The first is that an enema is a lot more thorough. I'm sorry, a colonic is more thorough than an enema. An enema may only reach the first 6 inches to a foot of the colon, whereas the colonic, with the whole process of during the session, we reach the whole 5-6 foot length.
Okay, and that takes how long?
Anywhere from 20 to 30 minutes.
Okay, that's not bad.
It's on average. Now the other thing to keep in mind is that with an enema, there's a lot more absorption of water, because just to give you a little too much information for some people, this might be a little uncomfortable, but with an enema, you infuse the water, you remove the apparatus, and you have to hold on to that water as long as possible. And then you release on the toilet.
Right.
Whereas with the colonic, it's a constant flow of water in and out because of the speculum is inserted into the rectum, so there's no retention, there's no discomfort. I'll retract that. Very little discomfort compared to an enema, because you're not retaining all that water. And as far as, you know, reabsorption of that water, there's less likelihood of reabsorption of that toxic water because of the constant flow. A lot of people don't realize that the colon is such a permeable membrane that you may reabsorb some of that toxic water. I mean, you're basically diluting the stool and all of the toxic buildup on the walls of the colon, and you can reabsorb some of that, and it can give you a headache, you know, all sorts of, you know, yucky, uncomfortable things. So most people who've actually experienced enemas, when they hear about colonics, they're like, oh, absolutely not, because their experience was so horrific with the enema, whereas people who've had no experience at all are probably a little more
receptive and easy about it. Okay.
Right.
So what can someone expect on their first visit with you? Tell us what we're going to go through.
Okay. Well, first, we have people come in a couple minutes before their scheduled appointment to fill out paperwork. It's just a couple forms. Gives us an idea of their background, their history, their childhood history, medical history, all of that, as well as, you know, we cut out any problems. If there's contraindications, we want to make sure that...
What would a contraindication be?
Could be a couple of things, like if a woman is pregnant and has never had a colonic before, as long as we've been treating her prior to her pregnancy, it's not a problem. But just like anything, when you're pregnant, you do not want to start something new, whether it's changing your diet drastically or starting an exercise regimen. You don't. We would not do that. Someone who's on some sort of treatment for cancer,
Okay.
recent abdominal surgery, things like that,
Okay.
we would not be able to, proceed with the session.
Okay.
The other thing is that we provide a bunch of information for the new client, give them an idea about what certain foods may irritate, not a diseased colon, but problems with the colon, how much water you should be drinking, give you different formulas to figure out according to your body weight, and also your fiber requirements, and where to get those fiber sources. I mean, a lot of people know that fiber is important, but they don't really know how to count it. So we give all that information to you, and it's very important. Because when you come in to get a colonic, yeah, you may feel great afterwards, but if you don't change your lifestyle, you're just going to go back to whatever's caused your problem in the first place.
Right.
So we try and empower you and give you information to change those habits so that you can graduate off and be a healthier person all around.
That's great. Well, actually, I had a new client today that was referred by your clinic, and interesting girl. I mean, she's young, and she's been doing colonics for about a year now, and she just said, I'm just not feeling good. My energy is really low, and I have this acne issue that comes and goes, and I'm just not where I should be. And she goes, and I want to have a baby soon, so what can I do? And we looked at her diet, and you know what? Her diet has improved because of what you've given her, but she's still not doing enough of the right things to really enhance her body's full capabilities. So thanks for the referral, by the way. But nonetheless, it's an adjustment, and it's hard for people to really put it all together.
Yes.
But colonics are a good start. I mean, that's how I started. 20 years ago.
Well, I mean, the other therapists that work with me were by no means nutritionists, but we can give them certain guidelines, and that's generally what I do if people want to further that, because a lot of people just want a quick fix. They think, oh, I'm going to come and get a colonic and everything's going to be
McDonald's,
okay.
And then I'll go ahead and do a colonic.
Yeah, and they're not really up for that lifestyle change for those who are a little more serious about it. Or, basically, pain is a really great motivator. If they're uncomfortable and pain in a lot of pain, that will give them more of an incentive to avoid whatever foods or increase whatever water or certain minerals or what have you, depending on the individual situation.
Well, I know you do a lot of educating. So you teach people about mucus-forming foods and fermenting foods and putrefying foods,
gas and bloating.
Yeah. So that's excellent, because people oftentimes don't put together what they put in here with what's going on down here. And of course, there's a direct correlation. So the other thing I'd like to bring in real quickly is you must see a lot of people with IBS, or irritable bowel syndrome.
Yes.
Which comes from years of being constipated, right?
Yeah, well, there's a lot of different issues going on with that. There's a lot of emotional things that can be attributed to IBS, as well, stress. I think that just exacerbates it. But yes, diet, eating high allergy foods, not drinking enough water, not getting enough of your good bacteria, lactobacillus, acidophilus.
Eating foods that wipe out the good bacteria.
Yes, there's
Coffee.
that too. Coffee, medications, drugs.
Yeah.
Foods that are too hot, too cold. I mean, that can all have negative effects.
Right. That's not good.
Fried foods, dead food diets. Not eating.
The American way.
Yeah, right.
It's like good for the business. I don't know. Not good for your colon, though.
But, I mean, what we try to do is to give our clients as much information as possible so that they are basically the empowered ones and can take control of their lives, and they're their own healthcare practitioners. That's what we urge everyone to do. We don't want them to be, stuck in this old, awful downward spiral habits. Yeah, so we try and give them,
Well, you have a motto that a healthy colon is a healthy body. Why?
Healthy colon is healthy. Well, I mean, look at it in terms of this. Your colon is basically your wastebasket. Is your body's wastebasket. And if your wastebasket is full, where's all the toxins that you breathe in, that you eat in, that you're exposed to on a daily basis, no matter, I mean, you could eat a perfect diet, but you're still going to be inundated by, your environment. Where are all those things going to go? If you don't have a well-functioning colon, your liver can't detoxify, your gallbladder, your pancreas, I mean, everything is affected. Your skin. I mean, it's all systemically correlated.
Right. And the lymphatics are packed.
Yes, lymphatics. You know, there's the statistic that I've heard recently that if a lot of people who have found that they have colon cancer and they go into remission if they find it in time, if it does come back, it usually comes back as lymphatic cancer. And you know, a lot of people don't realize that more than 50% of your lymphoid tissue is surrounded by your colon. It's all interconnected. You know, people think of things, you know,
being segregated,
and it's so not.
Yes,
it's not at all.
Well, let's put people's mind at ease here. What type of equipment do you use, and what should people look for when they look for a colonic hydrotherapy center, as far as safety, efficacy, and sterilization goes?
Right. Okay. Well, those are all really good questions. We use the wood gravitational method. There are, I want to say, about 9 or 10 different types of colonic methods and equipment. We use the old-fashioned method. It's basically a tank that's 3 feet above a table, and it's the gentle pressure of the tank being above the table that allows the water to, you know, flow into the body. It's not a machine. It doesn't use force pressure. It's very gentle. I think it's the safest and the most comfortable.
If you use force method on me. I mean, my body doesn't like it.
You know, I've talked to people who have used both the machines and the gentle pressure, you know, the gentle gravitational method, and you know, different people have different preferences. It really depends on the individual. But I would say, you know, for the elderly, for children, you know, people who have really sensitive issues, you don't want to force anything.
Water,
yeah. So you know, you just want to be as gentle as possible. We use an autoclave. It's called a Sterident. It's the same device that your gynecologist or your dentist use on their equipment. It's very safe. We use sterilization pouches. They're not removed until it's time to use them. For those of you who are still skeptical, we do have disposable speculums and hoses upon request. So, I mean, there's really no excuse not to take care of your body. Yeah, and get, you know, empty that wastebasket, so to speak.
Right.
So, what were the questions that you had?
Well, that was it. Really, what's the method and what do you do? And how long is a session?
It depends on the individual, but anywhere from 20 to 30 minutes.
Okay. How come I take so long?
Well, we use extra water on you because you're special.
I get lots of
There are those that, well, within that 20 to 30 minute time period, we use anywhere from 15 to 20 gallons. That's the average colonic. There have been times where we use more, like 30 gallons, and that's generally what you use. And there are people that require that. We would never do that your first, you know, a person's first time, but we would, you know, play around with it, and we keep notes and records so that we know, you know, how your progress. We mark your progress, and we give that information to you if you know, if you're interested.
So what about water? What kind of water do you use? Is it special?
Yeah, well, we use special filters. It's a double filtration process. It's these special filters that not only take out the sediment and the chlorine and the heavy metals, you know, the things that are found in, you know, municipal water, but also any kind of parasites. You know, a lot of people have parasite issues, or, you know, organisms and amoebas, and these filters take out all of that.
That's great.
Yes, and it's really important for those of you who don't, you know, who go to a colonic center, you know, not ours, and that's fine. There are plenty out there who are reputable. Make sure that the filtration process is good, because you don't want to add to your problems by, if they're using municipal water or well water, that you're not going to get an organism.
Klebsiella or parasites or heavy elements.
Yeah, Giardia.
Giardia.
Yeah, that would not be good.
Ugh. No.
Wreak havoc on the system.
Yeah, not good. So do you offer or use anything else besides water?
We do a couple of things. We can do implants. Let's say, you know, if someone was interested in infusing their system with good bacteria because they've got some sort of dysbiosis, which is an imbalance of the good bacteria, too much of the bad stuff, not enough of the good stuff. We can, you know, infuse the body with that. It's not uncomfortable. It doesn't take very long at all. I mean, that can be separate from the colonic as well.
You would do that after the colonic?
After the colonic
Okay.
would be the best time to do that, yes.
Okay.
And, you know, we could also do, you know, chlorophyll, things like that, healthy things. And I've had people ask me, well, do you do coffee enemas or coffee? And I have gone to many different schools. I've got my certification to teach colonics recently, and I've gone to different you know, schools that, you know, some of them endorse them, some of them don't. I've made the judgment that I'm not a big fan of the coffee enemas. What it does is it stimulates the liver. And if you've been getting coffee enemas on a regular basis, and God forbid, let's say you go to the hospital and your liver is malfunctioning, it's not working, what they would do is give you a coffee enema to kickstart that liver. Well, it's desensitized if you've been getting coffee enemas all along. And most people don't realize the carcinogens. I mean, you know this more than I do. You can probably list off 100 different chemicals that are found in coffee.
Right. It needs to be organic for sure.
Well, yeah.
And water processed.
Yes. I mean, and so I think it's adding insult to injury by doing that. We also do oil infusions.
What type of oils and why?
Well, the main oil that we use, at least its base, is sesame. It's an organic, unrefined meaning that there aren't any chemical processing.
Solvents.
Right, and it is completely organic. A lot of people don't realize that there are there's more than one type of dehydration. You know, when you wash your hands too much, they get dry and cracked, and so the same can happen, you know, with your colon.
In the tissue, yeah.
Right, so what we want to do is hydrate that area with the oil, and we do an oil infusion, and that again doesn't take very long at all. It takes a couple seconds, and you know,
until the colon absorbs the oil.
Depending on what it needs to do, you know, like I had mentioned earlier, the lymphoid tissue surrounds the colon. The oil is very insidious. It can go in, grab the toxins out of the lymphoid tissue, and your body will expel it if it needs to. Otherwise, if your body is really dehydrated and dry, you will absorb that oil. So
it'll work both ways. The body has a wisdom, in other words.
Right.
So it decides what to do with what.
Right.
Okay, whether it's going to work to pull toxins or heal and regenerate.
Exactly.
We love these bodies. It's a miracle.
Yeah.
So what about colonics? Tell me, are they dangerous or addictive? Like a lot of people are going to go to their doctor and the doctor will be like, you can't do colonics, they're dangerous.
Right.
Or they'll hear from someone that they're addictive, meaning you can't live without them. I've never met anyone like that, but have you?
You know, it could be possibly addictive up here. Psychologically, because you feel so great afterwards. But physical addiction, absolutely not. The main point of a colonic, a lot of people don't realize, you know, some people think, oh, well, you know, I'm coming in here because I'm constipated, I'm coming in to get cleaned out.
Right.
That's partially true. What I want to focus on is that the colon is a muscle. And a lot of times, you know, people don't realize, think of your organs in terms of being muscles. And when you don't use a muscle or it's malfunctioning, you lose it.
Right.
So your muscles can atrophy. You know, if you're
they become
prolonged,
lazy.
They become lazy and sluggish. And if you don't, you know, if you're not eating, you know, properly and you're constipated, your muscle will atrophy. The whole point of a colonic is to re-educate that muscle, is to retrain that muscle. So during the process, we're basically stimulating the peristalsis, which is that muscle flow, that muscle action, to get it to start working again. And in that process, then you're balancing your colon. You're not going to have, you know, constipation or diarrhea because you're going to be, you know, healthy and whole. So that's something that I really try to stress to people. And a colonic, I've explained it in terms of being like an aerobics class for your colon. You can't expect a miracle, you know, overnight in just one session be completely cleared out. You do need several sessions. And again, that depends on the individual. Some people rally a lot more faster than others. Age has nothing to do with it. I've had, you know, 60-year-old women who come in and their peristalsis kicks in within 2 weeks. I've had 20-year-old women, it takes longer. It really depends on the individual. The person, how well they're eating, their water, everything. So, and you had asked about danger, and that's a really good question. I don't believe that colonics are dangerous, except if you're going to someone who doesn't know what they're doing. That would be the danger. So you really have to be what you tell your clients, savvy consumers. You have to investigate, ask questions, make sure that your therapist is certified, that you go to a reputable place that follows codes, especially when it comes to cleaning everything and making sure everything's disinfected. I would actually go to the place and look at and check it out before I make an appointment. I mean, that's just smart. So when your doctor says it's dangerous, oh, and the other thing that they say is that colonics can deplete your electrolytes
and your flora
and your intestinal flora.
Right.
And again, a lot of people don't realize is that, okay, when you think of it in terms of when you're digesting, you've got these villi that have all the surface area that absorb the nutrients. Well, if your colon is completely impacted and covered and encrusted with, material, all that villi, I mean, think of it in terms of almost like a shag carpet. If it's matted down, that surface area is drastically depleted, and there's not going to be any absorption there in the first place. You're not going to be creating any of that good intestinal flora in the first place.
Right.
So what people need to do is clear that away and then re-inoculate with the good bacteria.
Okay. So the water helps move this garbage out.
Right.
And then the little villi can pop their little heads up instead of being smashed. They're like, woo, 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 and then they'll start to eventually start working.
Reabsorbing the good nutrients, keeping the bad stuff out, and helping your body create your own intestinal
Well, that's a really
flora.
good point, Christina, because most people, I believe, are under the concept or the precept that the colon is a refuse tank, and they don't have the awareness that the colon actually is an absorptive area that takes nutrients in from the foods that you've eaten, and it redistributes those nutrients to the liver.
Right.
To be broken down for usable energy for the body. So your body goes through this huge transitory process in the processing of those foods, in the utilization of those foods. And if the colon isn't working, the small intestine isn't working, you're not working.
Right.
So you end up with this compromised body.
And everything starts to back up.
Yeah. And then you end up with like chronic problems and aches and pains and skin issues, as you mentioned before.
Right.
So, everything is a reflection of whether or not, your digestive tract is front and center.
Right.
Right.
And in terms of the electrolytes, I mean, I've just read a recent article, it was in a medical journal, that you would have to, in order for your electrolytes to be affected, you would have to get a colonic every day for something like 6 months in order for there to be even
a slight imbalance.
Yeah.
Because the body is so amazing at regulating everything.
Right. So, I mean, these doctors, I appreciate what, they're trying to protect their patients, and that's all well and good, but they really need to be informed.
Right.
And unfortunately, I don't think, many medical schools, well, first of all, don't teach many nutrition courses.
Right.
They don't really have, I know the AMA doesn't even have an opinion on colonics, whether it's a negative or a positive thing.
Well, I don't know if they can really speak out too loudly about them, because the AMA is actually where colonics started. I mean, it started in Europe in the 17th century, I believe, wasn't it?
Well, colonics have been around for thousands of years.
Yeah.
But yeah, in the 1600s, it started in Europe, was the first distinction actually between an enema and a colonic.
Right. And doctors used enemas or high enemas.
But even here, I mean, up until the 30s, basically, colonics were something that your basic doctor would recommend for you for any kind of ailment. I mean, you went into a hospital, you got a colonic.
Right.
That was the treatment.
They used, from what I remember, they used wax, soap, and water.
Yeah.
Ugh, talk about electrolyte disturbances.
It definitely, I mean, we use pure water. Water is the best healing process. And on top of that, gosh, I forgot what I was going to say.
Okay,
but
so
there's so many points.
You were going to talk to me also about how often you recommend these sessions.
It differs for everybody. When someone's coming in for their first time, we generally recommend twice a week for a couple weeks starting out. You definitely want to spread them out no more than every 2 or 3 days.
How about back to back, a day back to back?
I am not a big fan of that. I've had people who were fasting and they wanted to come in and, do 3 or 5 in a row, and unless they've got a doctor's note, and I've had certain doctors, give a prescription to someone and say, hey, I want you to do this, and I will do that. As long as the doctor endorses it, that's fine. But basically what happens is that muscle starts to get stronger and you're retraining it, then that's basically...
So that's what the point is.
Right.
So you go by how the muscle's working.
How the muscle's working during the session, and also how well the client is doing on their own. They're only there twice a week out of how many hours in 1 week.
Right.
So
a normal bowel movement is 2 or 3 a day?
Yes. Basically, the idea is every time that you eat, you should have a bowel movement. And since the colon is anywhere from 5 to 6 feet long, depending on the individual, you should be moving half of that a day. So anywhere from 2 to 3 feet a day is ideal. If you're moving at least 2 feet a day, you're great.
America is constipated.
If you're moving less than 2 feet, you're definitely constipated. Even if you're moving 5, 6 times, a little bit each time,
right.
You're still constipated.
Wow.
Yeah.
So you want to get moving.
That's right.
So doesn't something like 60% of most diseases start in the colon?
Actually, more than that. Dr. Bernard Jensen thinks, I want to say 80 to 90% of all diseases can be traced back to a colon dysfunction. And I remember what I was going to say back then. Basically, when colonics were no longer being endorsed by doctors or the AMA, it was with the inception of antibiotics in the 30s. Right. That's when it started. So that's, they went from trying to use the practical and the holistic approach to treating it with drugs. And that's...
Enemas went out, so the AMA doesn't have a stand because they started it.
Right.
That's the bottom line.
Right.
So we're running out of time here, but what's the biggest major misconception about colon cleansing as far as you're concerned?
That it's painful, that it's indiscreet, that all your glory is shown to everybody, and you're completely covered throughout the whole session. It's not a problem. That colonics are only for constipation. That you're basically here to retrain your colon. I just want to point that out again. That you can become addicted, and there's also the misconception that colonics can cure everything.
Right.
And it can't. We cannot claim that.
Well, we're out of time, sweetie.
Okay.
I'm sorry.
That's great.
But thank you so much. That was a great show, and you really educated everybody. So we want to thank you for being with us. We have Christina Pfeiffer, owner of Colon Care Inc. here in Chicago, talking about colon health. If you have any more questions, give me a call. I'll refer you to her, and she'll be happy to answer whatever questions you may have or concerns. And until I see you again, take good care of your colon. Good night. I'm Deborah Arneson with Health Quest.
Thank you.
That's great.